if I wanted to go private for my cataract surgery, how much would it cost?
So assuming you have no medical insurance and you are going to self-fund, the average price of a straightforward cataract operation with a single focus lens is in the region of £2,500–3,000.
Per eye? Or?
Oh, per eye, yeah, absolutely per eye. But then if we're looking at doing combined cataract surgery with sight correction using a complex or advanced multifocal lens implant, then the costs are more, and it's in the region of £3,500–4,000 per eye, with some providers charging up to £5,000 per eye, certainly at the higher end of the market. I think for patients, what probably is good advice is to fully inform themselves and to do the research, watch videos like this, read about multifocal lens implants, and also to learn a little bit about their own prescription and to think through what it is they're hoping to achieve, what their visual priorities are. Is it golf? Is it reading? And to then make some phone calls or search on the internet about, armed with that little bit of information about what their requirements are and what their prescription is. And that certainly would help in terms of approaching the different people in the market and asking them, this is my situation, how much do you think it would be?
And what is it that influences different providers to charge different prices?
I mean, there's very much a market, and there are effectively kind of like high street chains who do very large volumes of surgery, and the reason they can maybe charge a bit less is that they do a lot of surgery. But then the experience in terms of the care and the direct contact with your consultant is definitely less with these high street providers, and you certainly wouldn't have direct access 24/7 to your consultant. There absolutely will be an appropriate level of care, but you're not going to be able to just pick up your phone and ring your consultant. But if you're looking to have your consultant available to you 24/7 to answer any questions, certainly then that's something that obviously the consultant will be doing less surgery, and probably the charge per procedure will be more.
Right. So it really comes down to the level of service that the patient can expect, the level of access.
Yeah, absolutely. Yeah.
And I suppose the availability of that consultant to them when they need them.
Convenience, yeah.
Which can be a really great thing if you're waking up in the middle of the night very concerned about how something might be going, and to be able to call. You'll answer a call like that?
Absolutely. I mean, our system is set up that you have the choice of, if it's an administrative issue, you can go through to my PA. But if it's an emergency and you feel it's necessary to speak to me directly, then absolutely there's an option to just connect directly.
That's great.
If you'd like to know more about vision correction surgery, give us a call and get started on your vision correction assessment.